Hi everyone, my name is Alice Pena. I'm a sophomore student here at FranU, and this is my oral presentation on nosocomial diseases and infections for my Fundamentals of Microbiology oral report. In this presentation, I will be speaking about the prevalence of nosocomial infections in healthcare facilities, how they are acquired, and the effects that they have. In addition to the most common types of infections, and how they can be spotted and prevented for everyone's safety. So first off, what is a nosocomial infection? Well, a nosocomial infection by definition is one that is acquired when receiving healthcare in a hospital setting that was not there when the patient was first admitted. It is also known by the name of a hospital-acquired infection. Nosocomial infections do not need to be acquired in a hospital. They could also even be acquired in any facility or areas of healthcare, such as an ambulatory setting or a long-term care facility like a nursing home. Some nosocomial infections may also even appear after the patient has been discharged and has left the healthcare facility. However, though, in order for an infection to be considered a nosocomial infection or hospital-acquired, it must fall within certain time frames. For instance, it must occur up to 48 hours after being admitted into a hospital, 3 days after being discharged, or 30 days after having had an operation of any sort. The effects of nosocomial diseases. Regardless of how or what infection is contracted during a patient's hospital stay, nosocomial infections can have several consequences on not only just the patient, but their family and even the healthcare facility where the patient contracted the disease can have consequences. These consequences range from longer hospital stays, increased costs, lost wages, and unfortunately even death. As seen in the graph to the right of the screen, it shows the mean or average cost per patient for each of the infections listed. As seen, the most common nosocomial infection, a urinary tract infection, a UTI, can add an additional cost of about $3,000 for the patient and up to $11,000 for having multiple nosocomial infections on behalf of the hospital's fault. Many nosocomial diseases all come from the same place or have the same origin. Besides coming from a healthcare facility, many nosocomial diseases are commonly introduced through a contaminated hospital environment, invasive devices such as a catheter, or objects that have been inadequately sterilized. They can also come from the patient flora, which is the bacteria belonging to the flora of the patient. It can actually end up causing infections if they're transferred to a tissue wound or a surgical site. Lastly, it can be transferred from medical personnel, especially if the healthcare workers lack good hygiene practices. Modes of transmission. While there are many modes of disease transmission, the 5 most common ways that nosocomial diseases can be transported by include the following: direct contact, airborne particles, vectorborne particles, droplets, and common sources, also known as common vehicular transmission. The most common way of contracting a nosocomial disease is through direct contact, which is hand-to-hand contact either from infected medical personnel or infected patients. Indirect contact. In indirect contact, there is absolutely no human-to-human contact, and it usually involves an inanimate object that has been contaminated by pathogens from an infected individual or a place. For example, an individual with the common cold could sneeze on a nearby object, causing droplets to land on that same object. Minutes later, someone else could come by and touch that same object and then transfer it to a portal of entry such as their mouth or their nose, and ultimately catch that same infection. Direct contact. Direct contact is the most frequent and most important mode of transmission of nosocomial infections. These are usually transmitted when a medical personnel turns a patient, they give that patient a bath, or they perform other patient care activities that require direct personal contact. Direct contact transmission can also even occur between 2 patients. Nosocomial diseases that come from direct contact are usually obtained from hand-on-hand contact that don't come from droplets or airborne illnesses. Usually direct contact transmissions contain secretions that are from patients or areas that are infected with some sort of illness. Droplets. Nosocomial diseases that originate from droplets can result in illnesses such as whooping cough or a streptococcal infection, like strep throat and pneumonia. They're usually from large respiratory droplets that come from other infected patients or medical personnel. Airborne particles. Airborne particles can create nosocomial diseases such as pulmonary tuberculosis and measles. These illnesses are usually transferred from airborne particles that come from infected individuals. Although airborne nosocomial outbreaks are pretty uncommon, they are, however, accountable for 10% of all nosocomial infections seen in hospitals. Common source transmission. Common source transmission is also commonly known as common vehicular transmission. These types of infections are transmitted indirectly by materials contaminated with the infections. This category of transmission has diseases and infections that are transmitted by food and water, as well as drugs in some cases. Some types of diseases that can be carried this way are foodborne salmonellosis, waterborne shigellosis, and bacteriemia resulting from the use of intravenous fluids contaminated with a gram-negative organism. Vectorborne. Vectorborne diseases are usually diseases that result from infections transmitted to humans and animals by a blood-feeding insect such as a mosquito, a tick, or a flea. Most of these vectors often transmit the pathogen by biting the host or the patient, creating a wound that serves as a portal of entry. Common types of nosocomial diseases. While the symptoms of each nosocomial disease will vary by the type, the most common are as seen: UTIs, or urinary tract infections, which are caused by E. coli, Enterococci, or P. aeruginosa; respiratory infections, which are caused by P. aeruginosa; blood infections caused by S. aureus, or a wound infection caused by Enterococci bacteria. The graph on the right shows the organism responsible for the most common nosocomial diseases, and then how common they are in causing one. Common body sites of infections. As seen in the pie graph to the right of the screen, it will show you the prevalence of infections per site. The most common known type of infection is a UTI, a urinary tract infection. This is due to its invasiveness and how common it occurs in among hospitalized patients every day. However, all of the infections seen in the chart are all caused by some sort of unclean or unsterile environment on an open wound or portal of entry, ultimately causing an infection. Epidemiology. Nosocomial infections and diseases have become associated with a significantly large morbidity and mortality rate, as well as an increase in healthcare costs for the healthcare facility. With nearly 100 million procedures performed at hospitals each year, nosocomial infections are increasing nationwide every day. An estimate from WHO, the World Health Organization, they state that approximately 15% of all hospitalized patients are suffering from some sort of nosocomial infection. Prevention. While nosocomial infections cannot be prevented 100%, it is still possible to reduce the amount of infections seen in healthcare facilities. For instance, attention to small preventative strategies such as hand washing, disposing of used gloves, masks, and gowns, and using effective sterilization methods may help reduce disease transmission rates. Conclusion. After watching this presentation, I would have hoped to shed more light on the importance of nosocomial diseases, which are infections that are acquired in a healthcare setting, and their wide range of negative outcomes for the family, the patient, and for the hospitals. In addition, I hope I gave more information on which are the most common types seen, how are they transmitted, and how they can be prevented in order to lessen their morbidity and mortality rate. Finally, these are my references, and references are also included in the footnotes of each slide.